We are going to Chocolate Hills for a sunset viewing, and also using it as a practice. Michelle's been trying to learn how to ride a scooter. She's pretty good at it already. She already knows how to ride it, but this is going to be a little bit of a practice because the incline is pretty steep up.
Oh yeah.
Yeah, up the Chocolate Hills. But you can do it. You can do it. You just gotta keep pulling on that throttle. You'll
I
be
don't
alright.
think we can pass. It's 5 o'clock. They close it at 5. Well, we'll walk up.
Let's see. If we can't pass, then yeah, we'll walk. But the sunsets over here are absolutely stunning, and there's not a single cloud in the sky. So if we can get there, we should get the full view. So
Tara na!
let's go. Dali na. Here we are. We have arrived at the Chocolate Hills complex here in Carmen. The view is stunning.
Introduce yourself first.
Well, they already know who I am. This is not the first video. This is MK and MK.
For new subscribers, I'm
Oh,
Michelle.
yeah.
And you're Martin.
Yeah, MK and MK, MK2X. So we got here at the Chocolate Hill complex to view the sunset. It's just right, like 4 minutes drive from us. So we try to make it a habit when there's nice clear weather to come up here to view the beautiful sunset here in the island of Bohol. Yeah, the views are spectacular. Actually, I'm gonna go show you a little bit more, so you can see really the entirety of it all. And as you sit here and watch the sunset, the colors actually change. The actual Chocolate Hills are right down there, perfectly round. Amazing phenomenon. Alright, let's go back to Michelle. She's looking lonely already. Been gone for 30 seconds. Relax.
I'm enjoying the view.
Yeah, the view is fantastic. So this is definitely a big plus why we decided to take the plunge and come and live in the Philippines. And luckily her family lives in Carmen, which is the area where these Chocolate Hills are located. So we're always just around the corner from these views. And that's the central center of attraction for Bohol Island, other than the beaches, of course, in Panglao, for instance, is these Chocolate Hills. If you do visit Bohol, you definitely have to come see Chocolate Hills, and hopefully you can catch a sunset or a sunrise. You can see Chocolate Hills.
It used to be on the World Wonders list. Because,
Used to be.
Used to be.
Who removed it?
It's very unique, and you can't see this anywhere else. Only in Carmen Bohol.
Yeah.
So, and a lot of tourism is because of this. It definitely drives traffic. So.
What was that? Sounds like a monkey. There's monkeys in here, wild monkeys, wild oak. Yeah, that sounds like a monkey.
Monkey. Yeah.
It's okay, we get it.
Well, I just want to give a shout out to my fellow nurses in the US, Canada, Saudi Arabia, all over the world, Australia, Sydney, places in Europe. It's Nurses Week, so I'm hoping that you guys are celebrating well and enjoying
Yeah.
your pizza for my New York nurses, tacos for my Texas nurses, and what do you think California nurses bring to work when they're celebrating?
I don't know, something vegan. Wine is vegan.
Well, they sure don't do know how to party, so
Mm,
they they uh, they celebrate with wine and cheese.
yeah. Why don't you? So in the spirit of Nurses Week, why don't you share the most inspirational story from your time as a nurse?
Most.
Yeah, something that affected you the most, maybe in a positive light or in a I don't know, something that stands out in your experience.
Well, I've had a lot, like several, um, but there's just thinking about Layla. Layla has developmental needs, and it's very, very hard. When she's not able to communicate yet.
She's our daughter, by the way. Maybe
Oh
start with
yeah, she's our
that.
daughter. She's not my patient, but she's
Yeah.
our daughter. But this one kid, 13 years old, got hospitalized because the mom could not take care of him in at home, and he's starting to get a point where he got violent. So it was too unsafe for him to go back home. And during my time, you know, um, I always thought about, like, what is he thinking, because everybody's afraid of him. Of course, he got huge, like huge, to a point where he's like very overweight. Um, you know, because he's only 13 years old, but he doesn't know any better, hurting anyone or like the consequences of doing that. So I tried to during my every shift when I was working, I tried to accommodate his needs, and bringing him his things that would make him at ease. When you're in a hospital, there's really not much to do. You stay in the room, and that's about it. All you see are four white walls, and no playground, and he's a kid. So, and I had to give kudos to the nurses also in that unit, because they sure do know how to take care of him. And
Where was this? New York or California nurses?
this was in California.
Give them a shout out.
Oh yes, my Kaiser Permanente nurses.
There we go. There we go. Represent.
You represent, right? So, you know, just thinking outside the box, what could make him feel kind of at home in a hospital setting, so that he doesn't get to a point where he was too violent to control and unsafe for the staff and the security guards, of course. So that was one of those things that really hit me, when you can relate to them personally. Not that Layla is violent, but
Well, she bites. She'll bite you. She'll pull your finger and so if you let her.
but I'm hoping that she doesn't get to that point.
Hmm.
And with all the things that we're trying to do to her,
So what was inspirational about that patient? Because
it really makes you look at life differently.
Mhm.
you know every patient is special, and in some way, as nurses, we're so in tune into our routine. We're always it's like we become robots sometimes, and having those type of patients make you step back and really think like, what is the patient need at this time? How can I be a better person? It makes you a better human when you're taking care of people that really can't,
Take care of themselves.
take care of themselves, and they don't really know. I mean, do you think he knows? Like, I mean, they think he knows some kind of, he has some understanding of what's going on, but it's,
Yeah.
they're different.
Does it also give like an appreciation for your own situation? I don't know if it's nice to say, but when you're dealing with a lot of people who are suffering in a hospital, doesn't it give you like a little appreciation for what you have, especially when it comes to health and, you know?
Oh yeah, oh yeah, of course. And that was part of, when I used to round with patients, I remember this couple, they had everything laid out, retirement place in Mexico, and everything set,
Oh, I remember you told me.
yes, good retirement, like financials, they have it all, but they were too sick
Yeah.
to enjoy and go to Mexico and live there. They could not live U.S. because
All their doctors are here,
yeah,
in the
health
US. We're in the
insurance,
US, the
yeah.
insurance, everything, and it creates a lot of fears. I remember you telling me about them. That was part of the reason that started pushing us towards the direction of taking this leap. And prior to this, to take a leap of faith in doing traveling nursing, because this was from the back when we were living in New York.
Yeah,
Yeah.
yeah, this was back in New York.
So
And that was just one
yeah.
of them. And I hear so many stories when I do rounds with my patients.
Yeah.
So it's just, it's so touching and makes you appreciate life more, rather than, wasting it when you have it all,
Yeah.
Oh, I wanna make it fun for our audience.
Okay.
So I'm gonna ask you questions to see how well you're paying attention to me as a nurse.
I'm not very good at this. Okay, bring it.
Okay. All right. Do you know what is a Foley?
Something that I don't want to experience, for sure. that I'm sure of. The rest I don't know.
Do you what do you think it means when I say, oh, I just had an enema from that meeting?
I know what an enema means. You should see how they used to do enemas in USSR. They used a device that I think they use it for two purposes: to heat themselves during winter, or to administer an enema. One of those rubber pouches with you fill it with hot water. Yeah.
Yeah.
My grandma was using it to warm her bed. I'm hoping that's the only thing she was using it for.
Have you heard of Flexi Seal?
It sounds like a disease. Oh, I had Flexi Seal. Sounds like a disease. I don't know.
It's a stool collection system.
Oh, great.
Where a patient, if they have constant diarrhea, for example, we use it to collect the stool, or else you'll be cleaning nonstop because the stool just comes out like diarrhea.
God. Okay, I think we had enough of stool talk for one day. This marks the end of our very first sunset sessions. I think we're gonna make this into a series as well, like Mango Tree series. We'll make a sunset series.
Yeah.
So if you have an idea for a topic that you'd like us to discuss, or something for us to talk about, be it about our life here in the Philippines or anything else, do drop a comment below and we'll address that in our next video.
And please subscribe.
Yeah, subscribe. Like, again, I forgot, we gotta say that in the beginning. Only the few survivors survive until the end of the video. Hopefully you're one of them, and if so, subscribe and like. See you next time.
Bye.